Hi guys. I'm coming back to you guys today to cover a very important topic, a very important issue while deciding to have surgery over in the DR or Colombia. So we're going to cover that today. As I mentioned in my initial video that I did a few days ago, um, I will be coming to you guys with as much info as possible. As I mentioned before, my surgery is scheduled for April 5th in Dominican Republic with Dr. Tania Medina. You're welcome to research her on Google, Real Self, Instagram, Facebook, and you'll be able to find out any additional information that I have not covered on her on those social media sites. Today we're going to discuss your hemoglobin, hemo levels, and the importance of you having it to a certain number prior to making the decision to going over to the DR to have surgery. Dr. Medina is very, very strict on having your hemoglobin level at a 12. To be honest, I'm going to be straight up honest with you guys. I had no knowledge about anything in reference to my hemoglobin level prior to getting the surgery instructions from Dr. Medina. And to be honest, I didn't really take it as serious as I probably should have until about a little bit over a month ago. I went into my PCP to have my annual checkup done, and at that moment, I knew that I was going to be having surgery in the DR. And as a result, I told him, I was very honest with him what I was doing, who I was doing it with. We sat down, we went over her surgery instructions, we went over her prescription list. He was kind enough to prescribe me certain things off of her list, which a lot of doctors are not happy with that. As I mentioned before, I have 4 surgery buddies, and a few of them, their doctors was not in agreement with not even prescribing antibiotics at all. I was very happy that my doctor was able to do that. I will not be providing his name or his info at all. But in any event, so when I did my blood work, the report came back, and I did my blood work probably like a month ago, I think, or month and a half, and I was sweating to find out or to get the report back so that I could know exactly what my hemoglobin level was. Needless to say, I was happy to find out that it was at a 14. So I've been trying to maintain it. I don't know what it is at this moment, but it is very important. Your hemoglobin is actually proteins in your red blood cells that brings oxygen throughout your bodies. That is kind of important. It's kind of serious. It's actually a matter of life or death situation if you don't have your hemoglobin in a certain at a certain number. First off, Dr. Medina is very strict on her patients as well as Dr. Altamonte. And I know about Dr. Altamonte because one of my surgery buddies is scheduled to go to Dr. Altamonte. So if you have any questions in reference to that doctor in the DR, I will be more than happy to check with my surgery buddies and my surgery buddy, and I'll be able to give you any answers to any questions that you may have in reference to that doctor. And both doctors require before they even touch you for surgery, for you to have one procedure done with them, your hemoglobin level needs to be a 12. For you to have 2 procedures, which means if you wanted to have a tummy tuck and you wanted to have lipo in your arms, which I want, your hemoglobin level needs to be at a 13 because that is considered 2 different areas. So it needs to be at a 13. If you want to have 3 procedures, which is, say for instance, you want to have a tummy tuck and you want to have your arms done and you want to have your inner thighs done, then your hemo level needs to be over a 14, which I want all of those. So I'm not necessarily, I doubt that I'm going to have all of those procedures done at one time. But in any event, because I know it is a possibility, I am going to make sure that I try to work on getting my hemoglobin level up or maintained at this point. Because you also have to remember, for us women, we do have our menstrual cycle on a monthly basis. And if you're going to have your menstrual cycle prior to your surgery, you're going to have to try to get your hemoglobin up as quickly as possible. How I'm currently getting my hemoglobin up, as well as the rest of my surgery buddies, we're currently taking Fluoridix, which is a liquid form of iron. You're gonna have to take iron. You're gonna have to take as much iron. Anything, you're gonna have to eat liver or drink beets juice or take iron supplements. Eat spinach. You could take. One of my surgery buddies suggested that I take black strap molasses. Let me tell you about that. I started taking that blackstrap molasses, and to be honest, to me, it kind of had taste like I was drinking soy sauce. And I told her, I was like, girl, I don't think I could do this. But she's like, listen, you need to get your hemo level up, so you need to take it. What I did was I would alternate. One day I would have the Floridix, which is really good. It tastes almost like grape juice. So I was one day I would take Floridix, another day I'll take blackstrap molasses, and I try to take as much thing as I possibly can, and I will continue to do so until our surgery and after our surgery. Because if we go out in the DR and we're having surgery and we're losing blood, we're going to have our hemoglobin up, and we're going to have to try to maintain it as much as possible. Also, as I said before, you do not want to go down to the DR to have surgery done not knowing what your hemoglobin level is, because you're going to be wasting your money if you go down there and you figure out that, oh my God, my hemoglobin level is below a 12. I guess you'll be going on vacation. Dr. Medina is not going to touch you. The majority of the doctors down there is not going to touch you if your hemoglobin level is not over a 12 or over. I have a surgery buddy. She had surgery done here in the United States, and there was nothing mentioned about her hemo level here. So I'm guessing it's just something that is required overseas. And also, I need to let you know, when you fly, one of the reasons why your doctors require for you to be in the country at least 48 hours before, the altitude will drop your hemo level. So I would suggest, if you know that you're going to have surgery within a week or 2 or 3 weeks, I would not take a bunch of flights up and down to pretty much lower your hemo level. I had to tell my husband, no, honey, we're not traveling anywhere for this month, because then my hemo level is going to drop and I'm going to have to work 10 times harder to pretty much get it up. So please, ladies, you can always find Floridix, Pure Absorb, regular iron tablets, supplements, all of them on Amazon. Blackstrap molasses I was able to find at Whole Foods. Try your best. The moment you put your deposit down on your doctor, start working on your hemo level. I know that Dr. Medina in her surgery instructions indicated to start taking iron 6 weeks prior to surgery, but you know, I would suggest that you also do that and follow your doctor's instructions, but it's important. Okay, so, oh, and there's also a test that you can take. It's called CBC test. In order to test your hemoglobin level, I would suggest to make sure to get that test done prior to leaving the country, as well as the moment you put your deposit down, at least to know where your levels are and what you're working with. In terms of a pregnancy test, I pretty much saw on a vlog that a doll went to the DR to have her surgery done without knowing her status, whether or not she was pregnant or not. And when she went there to do her lab, she found out that she was pregnant. She flew all the way to the Dominican Republic, spent money on a plane ticket, went down there, probably paid her doctor, her money, and was about to do her labs, and then she found out she was pregnant. She had to come back all the way to the United States without having her surgery done. Yeah, I'm sure she's gonna be happy because she has a baby on the way, but the whole purpose of you saving your money and you going to the DR is to have surgery. So just go to the dollar store, go to Target, order on Amazon, find yourself a pregnancy test, and just take it. It's worth it. It's worth the $10, $9, however much amount of money it is these days, for you to know for sure exactly, am I going to be able to have surgery or not. I just wanted to cover that for you guys really quick. Later, I will be doing a packing video for you guys, and my video may cover an extensive amount of supplies because I prefer to have more rather than less. I'm not going to go down to the DR just having surgery to go shopping. That's not going to happen. To try to find me supplies that I could have bought here, and I don't really know what my medical status is going to be. I don't know if I'm going to be able to lift my head up, let alone get off the bed for me to go try to find supplies that I need. I'll definitely cover my surgical supplies that I bought. I'm pretty organized, so I'll get through that video pretty quickly. If you guys have any questions or concerns, please subscribe. In reference to your hemo levels, in reference to the pregnancy tests, please let me know, and I will definitely respond to you guys as quickly as possible. I don't want to make this video too long because I'm going to have to gear up to go do my packing video. And I did make a decision. I will cover that in another video. I think I said eat spinach. Oh, too much iron is not good. My surgery buddy and I figured that out. We, I think, was overdosing on iron some way, somehow. And we started breaking out and started itching. So we had to slow down on the iron. Hopefully it helps, but we had to slow down on the iron. And also, I just want to let you know, it may be TMI for you guys, but I prefer to be upfront and honest. Many people suffer from constipation once they have consumed high levels amount of iron. So what I have done was, once I take iron, I pretty much buy the Fiber Well gummies, and I take those. I take like 2 every other day, and it pretty much just balanced things out for me. I know for a fact that they work because one of my surgery buddies, I suggested it to her because she was experiencing those problems, and she kind of started popping them like gummy bears, and it so happens that she kind of was going continuously in one day. And I was like, what happened? She was like, girl, those gummies were so good. And I was like, well, were you eating them like candy? She's like, yeah, just like gummy bears. I was like, oh my God, no, you need to only eat the recommended dosage that's on the bottle. So she kind of slowed down, and I'm sure she's stabilized. But if you have any questions or concern, please subscribe, please thumbs up, please comment. Make your comment below on the video, so that I could respond below, so that if anyone have any questions, the question may be answered in the comments below. Again, have a good night, ladies, my Kens, my dolls, and I'll see you in the packing video.